Hi, my name's Steve Pecoraro. I'm the care coordinator here at the Early Intervention Program of New York Eye and Ear Infirmary. So what is the Early Intervention Program? The New York City Early Intervention Program is a free, voluntary, confidential program funded and regulated by the New York State Department of Health and the New York City Department of Mental Health and Hygiene. It's available to all eligible New York City children regardless of race, ethnicity, income, disability, or immigration status. The mission of the Early Intervention Program is to identify and evaluate as early as possible those infants and toddlers whose healthy development is compromised and provide for appropriate intervention to improve child and family development. For children under the age of 3 who are either suspected of having or at risk for developmental delays or disabilities at no cost to families. The New York City Early Intervention Program offers a variety of services, such as nursing, nutrition, vision, speech therapy, physical therapy, occupational therapy, special instruction, assistive technology, transportation, and much more. Referring your child to the Early Intervention Program. A referral to the New York City Early Intervention Program can be made without a diagnosed condition. If you suspect that your child is at risk of delay, you may refer them. A referral can be made by a healthcare professional, family members, most importantly, you. You can do so by either calling 311 and asking for early intervention, calling your borough's early intervention regional office. You can also have your pediatrician fill out the early intervention referral form and fax it to your borough's early intervention regional office. Please note that this option is not available during the COVID-19 state of emergency. You could also call me. My information is listed here and it will be at the end of this presentation. The referral process takes between 5 to 7 business days. Your referral is processed by your borough's early intervention regional office. The early intervention regional office will then assign a service coordinator to your child's case. Your service coordinator will manage your child's case as well as guide you through the early intervention process. They will be able to answer any questions that you may have about the early intervention program, as well as coordinate the services your child requires. Eligibility. Any child from birth to 36 months is a candidate to receive services through early intervention. A parent may enroll their child at any point up until the last month of the child's 3rd birthday. In order to be deemed eligible to receive services, a child must have a delay in one or more of the 5 areas of development. The 5 areas of development are cognitive, physical, adaptive, speech and language, and social emotional. If your child is 2 years and 11 months or older and not already enrolled in the early intervention program, your child is eligible to receive services through the Committee on Preschool Special Education. This can be done by calling 311. Hearing loss is a medical diagnosis that yields a high probability of delay in communication, cognition, as well as social and emotional development. Although children with a diagnosed hearing loss are eligible to receive services through the early intervention program, they are still required to undergo the evaluation process. A series of evaluations known as multidisciplinary evaluations, or MDEs, are conducted by a team of qualified and approved professionals to evaluate the 5 areas of development. These initial evaluations will help identify possible delays in your child's development and determine as to whether or not your child is eligible for the early intervention program. Your child service coordinator will provide you with a minimum of 3 New York State approved evaluation sites to choose from. Multidisciplinary evaluations, or MDEs, can be conducted in the comfort of your home or at a New York State approved facility. The Early Intervention Program at New York Eye and Ear offers a wide range of facility-based services for children with a diagnosed hearing loss living in the 5 boroughs, which includes Manhattan, Staten Island, Brooklyn, Queens, and the Bronx. New York Eye and Ear does not provide home-based services. All evaluations and therapies can be conducted in the family's dominant language using our interpreter service. If your child was diagnosed with a hearing loss at another facility or has failed their newborn hearing screening, repeat or additional testing will be conducted by a pediatric audiologist at New York Eye and Ear. This is done in accordance with New York Eye audiology protocol and best practice to confirm a hearing loss, as well as ensure that there has not been a change in your child's hearing since those evaluations. New York Eye provides the following services: multidisciplinary evaluations, or MDEs, which are the initial evaluations to determine your child's eligibility for the early intervention program. These evaluations are conducted at New York Eye by a teacher of the deaf or hard of hearing and a speech-language pathologist. Supplemental evaluations are additional evaluations that your child may require, including audiological evaluations and speech and language evaluations. These evaluations are available for children already enrolled in the early intervention program. So if your child is already enrolled in early intervention and you suspect that they may have a hearing loss or a delay in speech as a result of a hearing loss, you may request to have a supplemental evaluation scheduled. Speech therapy. One-on-one therapy with a licensed speech-language pathologist that specializes in children with hearing loss. In order to properly develop typical speech and language, children with hearing loss require speech therapy to help facilitate the development of their listening and speech skills. Therapies are provided utilizing an auditory oral approach or spoken language. Therefore, if amplification is required in order for your child to gain appropriate access to sound, they must be fit with hearing aids. If your child was diagnosed with a hearing loss, it is highly recommended that they receive speech therapy by a speech-language pathologist who is experienced with children with hearing loss. Although families are able to acquire therapy in the comfort of their home, it is very difficult to find a speech-language pathologist that is experienced with children with hearing loss. In response to the COVID-19 state of emergency, New York Eye and Ear is now offering speech therapy via teletherapy. Parent-child group. Therapy conducted in a group setting. The group is composed of parents or caregivers, children, and one or more licensed speech-language pathologists that specialize in children with hearing loss. Parent-child group provides opportunities for socialization, communication, and peer interaction in a group setting, as well as positive, responsive interactions between service providers and children. Assistive technology. If your child was diagnosed with a hearing loss and they require amplification, such as a hearing aid or FM system, they're eligible to receive these devices along with batteries, ear molds, and accessories, as well as visits through the early intervention program. In order for your child to obtain hearing aids, they must first be medically cleared by an ENT doctor. At New York Eye and Ear, a pediatric audiologist will formulate and review an assistive technology packet with you. An assistive technology packet requests devices and accessories prescribed by your audiologist. This packet is signed by both the audiologist and parent or caregiver, then submitted along with the medical clearance from an ENT to the Bureau of Early Intervention Assistive Technology Unit for review. It takes around 3 to 4 weeks to receive approval for assistive technology devices and appointments. The audiologist orders your hearing aids and accessories, and then your child is scheduled for a hearing aid fitting. After your child's hearing aid fitting, your audiologist will typically schedule appointments at least once per month for hearing aid checks. The frequency of these appointments varies based on the child's age, degree of hearing loss, and specific needs. So here are the early intervention steps from start to finish. Your initial referral can take up to 3 to 5 business days to process. It may take up to 7 days for a service coordinator to be assigned to your child's case. It can take up to 30 days of referral to complete the MDE and submit to early intervention. It takes between 30 and 45 days for the initial IFSP meeting to take place, as well as for therapy to begin. Here's a list of our early intervention program resources. I've listed all of the 5-borough regional office contact information. And if you have any additional questions, you can always contact me. My name is Steve Pecoraro. I can be reached at 212-979-4620 or email. Now, without further ado, I would like to introduce our very own speech-language pathologist, Nicole Klein.